Go to any high school and ask what the greatest unmet need is. You'll likely hear about mental health services.
While waiting lists for professionals can be weeks, if not months, in one local high school, a long-standing program is getting to students and getting the help that they need just minutes after they ask. KCAL9's Chris Holmstrom has our Mental Health Monday segment inside Pomona High School's peer counseling program.
There's distance, there's bonding, there's angst, there can be comfort. All are part of the adolescent experience, undoubtedly magnified in the world of COVID.
The pandemic was very harsh.
But in this space, in this classroom, Lonzetta Calloway has found healing.
It's a safe spot.
This is the Peer Resource Center in Room 8 at Pomona High School. Sheila Balk is teaching a class that's expanding the school's mental health response force.
Unless you're sharing. This is our Peer Resources program, and the class that I teach is peer counseling.
Mrs. Balk says COVID-19 has led to unprecedented demand for mental health services.
People are having panic attacks. People are depressed. Their anxiety is through the roof.
It affected me a lot not being able to go out with friends. It messes with your mind.
Francisco Ayala sees the same in his peers.
A lot of people that I've noticed deal with depression or anxiety.
Here he learned he wasn't alone. A message he and fellow peer counselors like Valerie Cartagena share far and wide.
We're not professionals, but it does help to have students come in here and allow them to talk about their problems in a judgment-free zone.
I feel like I can provide the opinion of someone who understands.
Like so many of her peers, Teresa Bygrave was hit hard by the pandemic.
My anxiety got really bad, just being caged up. In my household, no one really knew how to help me.
Like everyone else in the program, she started out asking for help. Now she's learning how to provide it to fellow students.
Sometimes all you really just need is someone to listen for a second, and a lot of our parents don't have the time.
Among the lessons students are taught in this class, the importance of knowing their limits.
How do we hold a conversation? How do we ensure confidentiality and when to break it?
We get people that come in crying or just not feeling it that day.
If a student poses a danger to themselves or someone else, Titus Hayes knows to bring in Mrs. Balk, and she in turn calls a school psychologist. But more than not, Titus says students feel best sharing with a peer.
Our wavelengths kind of match up more than it would an adult, you know.
And there's no waiting list to get help.
When you don't know what you feel, it's very confusing.
But Carmen Ayala has found being a sounding board for her peers helped her.
Come to terms with my fear. Not only does it give clarity to my client, it gives clarity to me as well.
Mrs. Balk has taught peer resource class for the past 26 years. The painted bricks are mementos from graduates who found and provided comfort here. Despite the progress, there's work yet to be done, awareness yet to be raised.
I still think that mental health is very stigmatized.
But these teens hope that as word gets out about what they offer, schools elsewhere will follow their lead and introduce programs like this on their own campuses.
There'll be days where there's kids like me and wondering, when am I ever gonna get better? And I understand when kids say that because that's how I feel. And it took a while for me.
And we have much more on peer counseling and other mental health resources on our website, kcal9.com.